Did you know that every little sign can save a life? In today's video, we're diving into the key signs of stroke in seniors, those often overlooked indicators that are actually critical for life-saving intervention. The first moments when a stroke strikes are crucial. Join us as we explore how to recognize and respond in time before it's too late. Before we start, make sure to hit that like button and subscribe to the channel to stay updated with the most helpful health tips. Let's dive in. What is a stroke? A stroke is a medical emergency that occurs when the blood supply to part of your brain is interrupted or significantly reduced, depriving brain tissue of oxygen and nutrients. Within mere minutes, brain cells begin to die. This underscores why immediate medical attention is paramount. Strokes come in two main types: ischemic strokes, which are caused by a blockage or narrowing of the arteries leading to the brain, and hemorrhagic strokes, which occur when a blood vessel in the brain leaks or bursts. Recognizing the symptoms quickly is crucial because the brain is highly sensitive to interruptions in blood flow. As such, speedy diagnosis and treatment can dramatically improve the chances of recovery and minimize long-term complications. Time is the most critical factor in stroke treatment. Doctors often describe it using the phrase, "time is brain," which means that the faster a stroke is treated, the fewer brain cells are likely to be permanently damaged. For an ischemic stroke, which is the most common type, clot-busting drugs need to be administered within 3 to 4.5 hours of symptom onset for optimal results. In the case of a hemorrhagic stroke, rapid intervention can help control the bleeding and relieve the pressure on the brain. It's key to remember that strokes can affect anyone, regardless of age or health status, though certain factors such as age, high blood pressure, smoking, obesity, and certain medical conditions can increase the risk. Understanding what a stroke is and how crucial timely intervention is can empower individuals to act promptly should they or someone around them experience symptoms. Recognizing these symptoms and getting medical help quickly is akin to intervening in what could be a time bomb. It's an intervention that can save lives and significantly enhance quality of life. Awareness and education about stroke and its signs are the first line of defense against this formidable medical adversary. Number 1. Facial droop, a key sign. When it comes to recognizing the early signs of a stroke, facial droop stands out as one of the most visible and telling indicators. Imagine looking into a mirror and noticing that one side of your face seems different, perhaps your eye or mouth appears to sag awkwardly. This asymmetry is not just a fleeting quirk, it's a pressing signal that the neural pathways controlling facial muscles may be compromised. Facial drooping occurs when the muscles become weakened or paralyzed due to disrupted blood flow in the brain. For many, this may translate to an inability to smile symmetrically. One side of the mouth may remain immobile while the other responds normally. Additionally, an eyelid may droop, giving the affected side a tired, worn look even if the person feels fully alert. Mundane actions like raising an eyebrow or smiling can become unexpectedly challenging. This sign is crucial because it's visibly apparent to others. An individual may miss or dismiss the telltale signs themselves, but those around them can pick up on these changes rapidly. When you see this, it's essential to consider the possibility of a stroke immediately and seek medical evaluation. Early recognition gives a greater window for potential interventions. Moreover, unlike some other symptoms that may accompany a stroke, facial drooping typically happens suddenly, marking a sharp contrast from one's baseline appearance. This sudden onset is what makes it stand out as a critical alert. Facial drooping can be your first and possibly only cue in time to act. Encourage everyone around you to become familiar with this simple yet powerful indicator. Recognition can be the difference between intervention and irreversible damage. By being able to spot this early sign, you could play a vital role in ensuring that someone receives the urgent care they need, safeguarding their future health and functionality. Number 2. Arm or leg weakness. Picture yourself suddenly finding that an arm or leg feels strangely heavy or unresponsive, as if it belongs to someone else. This sensation of weakness or numbness in the limbs is not just unsettling, but it can be an unmistakable signal that a stroke may be occurring. Affected individuals might experience a tingling sensation or, even more drastically, an inability to lift or move the affected limb altogether. The suddenness of this weakness is what often alarms both the individual experiencing it and those around them. It's as if the body briefly holds hostage the freedom of movement that is usually taken for granted. This weakness typically occurs on one side of the body, opposing the part of the brain where the stroke is taking place. For instance, if the stroke affects the right side of the brain, weakness is often felt on the left side of the body. When facing someone with potential stroke symptoms, you might ask them to raise both arms. If one arm drifts downward involuntarily or refuses to cooperate, it's a key diagnostic clue pointing toward a stroke. Similarly, attempting to stand or walk might suddenly require Herculean effort as balance and coordination falter. This experience is more than just a physical challenge, it serves as a loud, urgent call for immediate medical attention. Left unaddressed, the symptoms can escalate rapidly, further compromising mobility and increasing the risk of falls and secondary injuries. Prompt recognition and response are vital. The sooner healthcare professionals can intervene, the better the chances of reversing the neurological damage. Interventions might include medications to dissolve clots, physical therapy to restore movement, or other approaches tailored to the type of stroke and individual circumstances. In the tapestry of stroke symptoms, arm and leg weakness weave a narrative of urgency. By understanding and reacting to this sign, one becomes an advocate for timely, life-saving medical intervention. Don't hesitate to acknowledge the seriousness of this symptom. It's a race against time that can preserve well-being and autonomy. Number 3. Speech difficulties. Imagine trying to communicate, but suddenly, your words come out garbled or slurred, as if your tongue is no longer under your command. This unsettling experience is often what individuals face when they encounter speech difficulties, one of the hallmark signs of a stroke. It's a moment when language, something we often rely on without thinking, becomes an undecipherable puzzle. Speech difficulties during a stroke can manifest in various forms. For some, it might mean speaking in a slurred manner, where words lose their crispness and merge into each other. For others, the challenge may lie in articulating thoughts at all, finding themselves struggling to find or pronounce the right words. In some cases, the person may experience aphasia, where they are unable to comprehend or formulate language entirely. This disruption in communication isn't isolated. It reflects critical neurological distress. The brain's language centers, typically located in the left hemisphere, are hampered, affecting both expressive and receptive communication skills. The sudden onset of these difficulties is a glaring signal that should never be ignored. For both the person experiencing these symptoms and those witnessing them, time is of the essence. Asking the person to repeat a simple sentence can serve as a quick test. Speech that is jumbled or inconsistent with normal patterns is a strong indicator of a potential stroke, warranting immediate medical attention. The emotional impact of speech difficulties is substantial. In addition to the immediate confusion and frustration, lingering communication challenges can affect social interactions, self-esteem, and independence. Early intervention not only prevents further damage but also enhances recovery prospects, allowing for targeted therapies that address speech and language restoration. By recognizing and responding to speech difficulties without hesitation, we can act as guardians of communication and connection. Listening carefully and reacting promptly can lead to earlier intervention, better outcomes, and a path back to the rhythms of normal conversation, one coherent word at a time. Number 4. Vision problems. Imagine the world around you suddenly blurring, colors and shapes melding into a haze, or even going dark in one or both eyes. Vision problems as a symptom of stroke are both alarming and disorienting, transforming ordinary perception into an abrupt challenge. This symptom underscores the profound and immediate impact a stroke has on sensory processing. Vision changes can occur in different forms. Some individuals might experience double vision, where objects are duplicated in their field of view, making navigation precarious. Others might face partial or complete loss of sight in one or both eyes, creating a sudden blind spot. Sometimes, peripheral vision is affected, which interrupts the ability to see objects or people approaching from the sides. These changes in sight are often linked to the areas of the brain responsible for processing visual information. When blood flow is disrupted by a stroke, these regions may fail to function properly, resulting in a spectrum of visual disturbances. The sudden loss or alteration of vision isn't just a sensory experience, it's an urgent warning that requires immediate attention. Vision problems during a stroke can also significantly increase the risk of accidents. Disorientation and decreased spatial awareness mean even familiar environments become fraught with hazards, emphasizing the necessity of a quick response. For bystanders, noticing someone struggling to visually orient or reach for objects can be telling signs. Whether it's watching someone bump into furniture or strain to read a sign, these observations can prompt swift action. The implications of unaddressed vision changes extend beyond immediate safety risks. Persistent vision problems can affect balance, mobility, and overall quality of life, limiting a person's ability to engage with the world around them. Early detection and treatment efforts not only halt further damage but also set the stage for rehabilitation processes focused on improving or compensating for vision loss. Be vigilant and alert to shifts in vision. They are not just changes in sight, but signals of the brain's distress. Acting on these warnings can preserve vision and life, reaffirming the value of prompt intervention. Number 5. Dizziness and loss of balance. Envision the floor shifting beneath your feet, or the room spinning around you despite standing still. These sensations of dizziness and loss of balance are common indicators of a stroke, thrusting individuals into a precarious situation where stability becomes elusive. Such symptoms disrupt more than just physical equilibrium. They signal an urgent need for medical evaluation. Dizziness during a stroke can manifest as a feeling of vertigo, a spinning sensation that can make orientation difficult. It's not just a momentary loss of balance, as one might experience on trying to stand up too quickly. It's a profound disconnection from the body's usual bearings. Loss of balance often accompanies this vertigo, leaving individuals struggling to walk or even stand without support. The cerebellum, located at the back of the brain, plays a crucial role in coordinating movements and maintaining balance. When a stroke impairs blood flow to this area, the resulting dizziness and balance issues are immediate indicators of potential brain distress. This symptom makes even simple actions like turning one's head or reaching for a stationary object challenging, increasing the risk of falls and injuries. For someone witnessing these signs, observing an individual suddenly stagger or grip onto nearby objects for support provides clear cues. It's crucial to remember that these are not minor inconveniences but potential harbingers of critical neurological events. Prompt recognition and response can make all the difference. Prolonged dizziness and balance issues resulting from unchecked strokes can restrict mobility significantly, leading to loss of independence. Additionally, they compound other stroke-related challenges such as weakness in limbs, making rehabilitation and recovery even more complex. Quick intervention, on the other hand, opens paths to therapies that focus on restoring balance and movement, enhancing the individual's ability to navigate their environment safely. So next time you encounter someone who appears unsteady or disoriented, consider it a call to action. By recognizing dizziness and balance issues as warning signs of a stroke, you not only support someone's immediate health, but also lay the groundwork for their longer-term recovery and independence. Number 6. Severe headache as a warning. Imagine a bolt of pain striking without warning, a headache so fierce and unrelenting that it demands your complete attention. Sudden, severe headaches are often underestimated, yet they can be a significant indicator of a stroke occurring, particularly a hemorrhagic stroke, where bleeding in the brain exerts intense pressure. This isn't your typical tension headache or migraine. Rather, it is described as the worst headache of one's life. The pain typically strikes very quickly, escalating to an intensity that can be debilitating. In some cases, these headaches are accompanied by other symptoms, such as neck stiffness, nausea, or vomiting, which further complicate the picture and highlight the seriousness of the situation. The underlying cause of such a headache can often be traced to a ruptured blood vessel in the brain. This event creates miniature eruptions, flooding the surrounding tissue with blood, leading to swelling and additional pressure. The result is not only excruciating pain, but also a heightened risk of further complications if left untreated. For those around someone experiencing this form of headache, the signs are often visible through pained facial expressions, sensitivity to light, or a person who's normally active now immobilized by agony. The urgency cannot be overstated. Headaches of this nature are a medical emergency requiring immediate attention. Failure to address the root cause of a severe headache swiftly can result in long-lasting consequences. The pressure from bleeding within the skull can lead to significant brain damage or even be life-threatening. However, when identified and acted upon quickly, medical interventions can alleviate pressure, repair damaged vessels, and mitigate further complications. The presence of a severe headache as a symptom is a clarion call to act without delay. Understanding this symptom as more than an inconvenience enables urgent responses that safeguard life and preserve neurological function. When you heed the warning of a sudden, severe headache, you become a vital link in the chain of life-saving intervention.